1 in 3 of us will be affected by cancer in our lifetime, and 2 million people are living with cancer in the UK. So how would you know if you've got the signs of cancer developing? What are the signs and symptoms that we need to look out for? The 2 main things to be looking out for is anything that's unexplained and anything that's persistent. So what do we mean by that? So anything that's unexplained, so anything you can't or you don't know what's causing that symptom. I'm going to use a headache here. We all suffer from headaches from time to time, but it's a headache that you can't explain. So, something, for example, like you haven't been wearing your glasses, or you've been studying really hard and you haven't been taking enough breaks. You've not been drinking enough, so you've got dehydrated. So you can kind of explain, oh, well, that's why I've got a headache. The other thing is, for example, persistence. So something that doesn't go away or keeps coming back and starts to get worse. So that headache, for example, so you can kind of explain why you've got the headache, but it's persistent. So you take some paracetamol, painkillers, for example, and if that goes away and doesn't come back, it was just a headache. But what we're looking at is things that you can't explain what's happening, and it's persistent, keeps coming back or starts to get worse. So what are the 5 most common signs and symptoms of cancer? Well, firstly, pain. Okay, not all cancers are painful, some of them are painless. But if you're getting a pain in part of your body, and again, you can't explain it, and it's persistent, keeps coming back, and it might be getting worse, then this is something you might want to seek help about. A lump, bump or swelling. So something that you found in your body, a lump, bump, swelling that hasn't been there before, you can't explain why it's there, and it's something that's not normal for you. It might be painful, it might not be painful, but if you can't explain it, it's not normal for you, then it's something you might want to question and think, well, what's going on here? Extreme tiredness. We all suffer from tiredness. We're all exhausted from time to time, or most of the time. But very often, if you've rested and you've taken it easy, taken a couple of days off, that tiredness will resolve and you'll start to feel your normal self. But when we're talking about this extreme tiredness or fatigue, this is when you can't even lift your head off the pillow, or you can't actually, carry out your day-to-day routine things. This is going on for a long period of time, and actually it's getting worse. There's something not right there, and you need to get it checked out. Significant weight loss. So yes, we may all be dieting, we may be doing Weight Watchers or the cabbage soup diet, and hopefully, if you want to lose weight, you're going to lose weight. But it's when you're not trying to lose weight, and you're not just losing a couple of pounds, you're actually losing, half a stone over a very short period of time, over a couple of weeks, and you haven't been trying. That's a warning sign that something's going on that's not quite right, and you really need to go and get that checked out. Might not be cancer, but it could be a sign of cancer. Go and seek help. Another common sign of cancer, or certainly of skin cancer, is changes within a mole. So again, get to know your body, get to know where your moles are, how big they are, what size they are, what shape they are. And if they start to change for whatever reason, so they might start to get bigger, it might start to get flatter, or the edges might change their shape, become itchy, they might even start bleeding. Clearly that's not normal for you. Again, it's unexplained and it's persistent because it doesn't go away. Get that checked out because it might be the first signs of skin cancer.